It is covering of rectus abdominis muscle that is formed by lateral muscles of the abdomen. This is transverse section. So we made this transverse section, yes, in the transverse plane. So we divided a human into two parts, yes, superior and inferior. And now we are looking. This is anterior aspect and this is posterior aspect. Structure of rectus sheath is different. Above and below the umbilicus, or above and below the arcuate line. So this transition from one structure of rectus sheath to another is named arcuate line because it's arcuate in shape. It's arcuate in shape. So what? First, let it be above. Let it be above. So here in the middle you can see two rectus abdominis muscles. Yes, they appear right and left. And laterally there are three muscles of the lateral group: external oblique abdominis, internal oblique abdominis, and transverse abdominis muscle. And I told you that medially all of these muscles continue into aponeurosis. Yes. So aponeurosis of external oblique abdominis muscle covers rectus abdominis muscle from anterior side. And then aponeurosis of internal oblique abdominis muscle gets divided into two lamina, superficial and deep. So superficial lamina covers rectus abdominis muscle from anterior side also. And deep lamina covers it from posterior side. And aponeurosis of transverse abdominis muscle also covers rectus abdominis muscle from the posterior side. And then behind the transverse abdominis muscle there is transverse fascia and peritoneum. This is above. Above, both anterior and posterior walls of rectus sheath are formed by 1.5 muscles. Yes, anteriorly it is external oblique abdominis and superficial lamina of internal oblique abdominis, and posteriorly it is deep lamina of internal oblique abdominis muscle and transverse abdominis muscle. Below, a structure changes. Below the arcuate line, first of all, internal oblique abdominis muscle doesn't split into two lamina. Yes, it is just one aponeurosis, and it goes in front of the rectus abdominis muscle. And transverse abdominis muscle also covers rectus abdominis from anterior side. And then posteriorly there is only transverse fascia and peritoneum. So that's why posterior wall of rectus sheath below the umbilicus is also considered to be a weak place of the abdomen, because anteriorly there are three muscles, yes, and posteriorly there are no muscles at all. Transverse fascia and peritoneum, both of them are very thin layers.
Peritoneum also thin layer.
Yes, much thinner than muscle. So you, at the next lesson, at the beginning, you will draw any of these structures, rectus sheath, above or below the umbilicus. Any questions?
No, ma'am.
Okay. So then if you have more questions, please. They are divided into two groups: superficial muscles and deep muscles, or proper muscles of the chest. So first we will start with superficial muscles. They are four. This is pectoralis major muscle, then under it there is pectoralis minor muscle, then serratus anterior muscle, and subclavius muscle. So we'll start with pectoralis major muscle, musculus pectoralis major. It originates from medial, there are three parts in pectoralis major muscle. Yes, there is clavicular part, sternocostal part, and abdominal part. Clavicular part originates from medial 1/3 of the clavicle. Sternocostal part originates from anterior surface of sternum and costal cartilages of the true ribs from the 2nd to the 6th. And abdominal part originates from aponeurosis of external oblique abdominis muscle. And then pectoralis major muscle gets inserted to the greater tubercle and crest of greater tubercle of the humerus here. So this is also pectoralis major muscle. Action of this muscle is adduction of the upper arm and pronation of the upper arm. And that is all. So between lateral margin of pectoralis major muscle and anterior margin of deltoid muscle, there is delta pectoral sulcus, sulcus deltoidea pectoralis. That's it. Okay, under the pectoralis major muscle, there is pectoralis minor muscle, musculus pectoralis minor. It originates from cartilaginous parts of the ribs, from the second to the fifth, and then bundles of this muscle, they move upward and laterally, and they are inserted to the coracoid process of the scapula. That's it. So this is pectoralis minor muscle. Actually, in pectoralis minor muscle, in coracoid process, there are three muscles which are originate or get inserted to the coracoid process. Two muscles originate. They are short head of biceps brachii muscle and also coraca brachialis muscle, and one muscle gets inserted to it. It is pectoralis minor muscle. So the action of this pectoralis minor muscle is adduction of the upper arm and also medial rotation. That's it. Both muscles, pectoralis major and pectoralis minor, can act as accessory muscles of respiration. So if upper limbs are fixed, then they can, both of these muscles, both muscles can elevate the ribs. Okay, pectoralis major and pectoralis minor. The other muscle, it is serratus anterior muscle, musculus serratus anterior. Here it is. It originates from, it originates from medial margin of the scapula, and then it moves forward and downward and medially, and it is inserted to the ribs from the second to the ninth, forms like teeth-like structures. And its action is also to elevate the ribs, like it also can act as accessory muscle of respiration, or it pulls scapula laterally. Can pull also scapula laterally.
Ma'am, it's not attached to the scapula. How does it?
It originates from medial margin of scapula.
Margin of the scapula.
Yes.
Okay.
And there is also subclavius muscle. Here we cannot see it. It is small muscle. It is stretched between inferior surface of clavicle and the first rib. And so the action is to approach clavicle to the first rib. This is subclavius muscle. These are superficial muscles of the chest. Under the superficial muscles, there are deep muscles or proper muscles of the chest. And they are also four. They are external intercostal muscles, internal intercostal muscles, transverse thoracic muscle, and subcostal muscle. In some books it's written that levatus castarum muscle also belong to this group. But in the other books it's written that these are deep muscles of the back. So first we will start with external intercostal muscles, musculi intercostalis externi. Here we can see them. So these external intercostal muscles, as well as internal, they are located in the intercostal spaces between ribs. So external intercostal muscles originate from lower margin of the upper rib, and they are inserted to the upper margin of the lower rib. Direction of fibers for external intercostal muscles is forward, downward, and medially, like that. So external intercostal muscles, they are present everywhere in the intercostal spaces except place close to the sternum. Here, instead of external intercostal muscles, there is external intercostal membrane, membrana intercostalis externa. It is semi-transparent. That's why here we can see from inside internal intercostal muscles. Internal intercostal muscles, they have opposite direction. So the action of external intercostal muscles is to elevate the ribs. Yes, these are main respiratory muscles. They always participate in respiration. So the other muscle is internal intercostal muscle, musculi intercostalis interni. So this muscle, vice versa, it originates from superior margin of the lower rib, and it is inserted to the lower margin of the upper rib, and direction of fibers is opposite. If external intercostal muscles are directed forward, downward and medially. Internal intercostal muscles are directed forward, upward and medially. Forward, upward and medially. And they depress the ribs. So they participate in exhalation. Yes? So these muscles are present everywhere in the intercostal spaces except the place medially from the angle of the rib. Here. Here we cannot see these muscles. Yes? Here instead of the muscles we can see just internal intercostal membrane. Membrana intercostalis interna. Okay.
Near the sternum region, no, ma'am?
No, not near the sternum. Close to the vertebrae.
Okay.
Yes, posterior side. Okay, transverse thoracic muscle, musculus transversus thoracis. It is unpaired muscle. Here we can see it. It originates from the sternum, and fibers of the muscle radiate, and they get inserted to the cartilaginous parts of the ribs from the second to the ninth here. And the action of this muscle is also to depress the ribs.
Ma'am, like a serratus anterior, it is also inserted to the second to ninth rib, no?
Yes, but in the other place. This muscle is from internal surface, yes?
Okay.
Okay. Then subcostal muscles, musculus subcostalis, here they are. The direction of subcostal muscles, like internal intercostal muscles, origin is superior margin of the lower rib and insertion is inferior margin of the upper rib, but unlike internal intercostal muscles, subcostal muscles, they overlap one rib. So they are not inserted to the adjacent rib. They overlap one rib, and so they are inserted one rib above. And they are present only at the regions of the angles of the ribs. And the action is also to depress the ribs. So these are proper muscles of the chest. Levator castarum muscles, they originate from external surface of the ribs. We cannot see them here. From the region of the angles, and they inserted to the ribs below. And they elevate the ribs. Levator castarum muscle. Okay, these were muscles of the chest. Now muscles of the abdomen. Muscles of the abdomen are also divided into several groups. They are three. There is anterior group, anterior group of the abdomen, lateral group of the abdomen, and also posterior group of the abdomen. So first we will start with anterior group of the abdomen. It includes two muscles. One of them is rectus abdominis muscle, musculus rectus abdominis, and the other one is inconstant muscle. It is pyramidalis muscle. So first we will start with rectus abdominis muscle. That's it. It is paired muscle. It originates from superior margin of pubic symphysis, and then it moves upward, and it is inserted to the xiphoid process of sternum and costal arch, so to lower ribs. Yes, cartilaginous parts of lower ribs. So the action of this muscle is to flex the trunk, and also it is one of the main muscles that maintains intra-abdominal pressure. Yes, intra-abdominal pressure. So fibers of this muscle, they are directed vertically, and a specific feature of this muscle is the presence of tendinous intersections. Tendinous intersections. They are usually from usually three. Yes, and these tendinous intersections, they divide muscular parts into several square-shaped muscular fibers into several square-shaped parts. Yes, and in sportsmen, in people who train these muscles, they look like abs. Yes. But it is due to this muscle. So here we can see one tendinous intersection. It is at the level of umbilicus. The other one is located in the middle of the distance between xiphoid process and umbilicus. And the third one is in the middle of the distance between superior margin of pubic symphysis and umbilicus. Okay. Pyramidalis muscle is inconstant. It originates also from the superior margin of pubic symphysis, and it is inserted to the linea alba. Linea alba, it is a special structure that is formed by lateral muscles of the abdomen, and Yes, it is between two rectus abdominis muscle. We will talk about it later. So lateral group of the abdomen. There are three muscles. There is external oblique abdominis muscle, internal oblique abdominis muscle under the external oblique abdominis, and there is transverse abdominis muscle. So external oblique abdominis muscle, musculus obliquus externus abdominis. Here it is. It originates from transverse processes of the lumbar vertebrae and also from lower ribs and posterior one third of the iliac crest, and then fibers of this muscle, they move again. Direction of fibers of external oblique abdominis muscle corresponds with direction of fibers of external intercostal muscle. So it's also directed forward, downward, and medially. Yes. So this muscle moves forward, downward, and medially. And medially, it continues into a broad tendon. Broad tendon is aponeurosis. And so it is inserted to the superior margin of pubic symphysis, and also it covers rectus abdominis muscle from anterior side, and both external oblique abdominis muscle in the middle, they form linea alba, and inferiorly external oblique abdominis muscle forms inguinal ligament, ligamentum inguinale. Here it is stretched between superior anterior iliac spine and superior margin of pubic symphysis. And this ligament, we will later see, forms inferior wall of inguinal canal. So the action of this muscle, in case of unilateral contraction, it rotates the trunk to the opposite side. Yes, to the opposite side. And in case of bilateral contraction, it flexes the trunk. And it also maintains intra-abdominal pressure. Then internal oblique abdominis muscle, musculus obliquus internus abdominis, here it is. It lies under the external oblique abdominis muscle, and it originates from iliac crest and from transverse processes of lumbar vertebrae, from thoracolumbar fascia, from lateral one third of inguinal ligament, and then fibers of this muscle, they move upward. So direction of fibers of internal oblique abdominis muscle corresponds to the direction of fibers of internal intercostal muscles. So it is directed forward, medially, and upward. Yes, and then it also participates in formation of linea alba, and it is inserted to the lower ribs. Yes, and also to the medial one third of the inguinal ligament. So that is internal oblique abdominis muscle. Action. During unilateral contraction, it turns the body to the same side. And in case of bilateral contraction, it flexes the trunk, and it also maintains intra-abdominal pressure. Okay. Then the innermost muscle is transverse abdominis muscle. Here we can see it. Musculus transversus abdominis. So for external and internal oblique abdominis muscle, direction of fibers was oblique. Yes? For transverse abdominis muscle, it is transverse. It is transverse. So, and here we can see it. This is transverse abdominis muscle. So it originates from transverse processes of lumbar vertebrae, from thoracolumbar fascia, and then it goes, fibers, they move forward, like surround lateral wall of the abdomen, and medially they continue to the aponeurosis and cover rectus abdominis muscle, and also participate in formation of linea alba. So in case of unilateral contraction, it rotates the body to the same side, and also it regulates intra-abdominal pressure. So linea alba, what is it? This is linea alba. Here we can see it. Linea alba, or white line in Latin, is located between two rectus abdominis muscles, and it is formed by aponeurosis of all three broad muscles of the abdomen: external oblique abdominis, internal oblique abdominis, and transverse abdominis muscle. Можно, пожалуйста, потише разговаривать, да ведь? Спасибо. Вот. And this, it is formed by aponeurosis. It means...
Are you upset?
Yes, you are disturbing me.
Just for this.
But you are disturbing me. Is it okay? You can speak in a whisper, yes? Because I'm explaining and you talk to each other. Вот. Linea alba is formed by connective tissue, I told you, and by aponeurosis of external, internal oblique and transverse abdominis muscle. Здравствуйте. So, here, it's located in the middle between two rectus abdominis muscles. Thickness and width of linea alba is different below the umbilicus and above the umbilicus. Above the umbilicus, it is wider and thinner. So this fact that linea alba, if to translate it from Latin, it will be white line. So because it is formed by connective tissue and because there are not so many blood vessels. And so this fact is used by surgeons in their practice. When they are planning any big surgery on the abdominal organs, they make a dissection here along the linea alba. It is named median laparotomy. Yes, so blood loss in this case will not be very big if to compare with a dissection through the muscle. But also, because it is not that much thick as all the surrounding tissues, linea alba is considered to be a weak place of the abdomen, especially its upper part, because I told you, above the umbilicus it is wider and thinner, and below the umbilicus it is thicker and narrower. Weak places of the abdomen are those parts of the abdominal wall where hernia can be formed. Do you know what is hernia?
Vertebra extra part. Invertebral disc outward.
No, invertebral disc it also can be formed, but it is like a protrusion, like exit of internal organs through the wall of the body. Yes, through the weak place.
Most herniate in the inguinal region.
Yes, yes. So, because inguinal canal, we'll talk about it later, it is also weak place of the abdomen. So, linea alba, especially its upper part, umbilical hernia very common, yes, at the region of the umbilicus. There is one more thing. Yes, lumbar triangle. We need to rotate it, please. Let's rotate it. Here we can see lumbar triangle. It is also weak part or weak place of the abdomen. Inferiorly, it is bounded by iliac crest, and posteriorly by latissimus dorsi muscle, anteriorly by external oblique abdominis muscle. And flow of this lumbar triangle is formed by internal oblique abdominis muscle. So lumbar triangle, OPT triangle, is also weak place of the abdomen. Yes. Okay, what else should we say? It was about linea alba. Fine. Then posterior group of the muscles of the abdomen is presented only by one muscle. It is quadratus lumborum muscle. Here we can see it. No, not quite clearly, but here we probably can see it. That's it, yes. So, quadratus lumborum muscle originates from medial 1/3 or posterior 1/3 of the iliac crest, and then it moves upward, and it is inserted to the 12th rib. And this muscle action, it is flexion of the vertebral column. Okay, this we are... yes.
Is it flexion or it's extension? Quadratus lumborum, so it should bend the body backwards.
Backwards.
Something. It should.
Extension होना चाहिए, हाँ.
Yes, I think it is extension. You're right. Yes, it will be extension. Right, extension of the vertebral column. Yes. What else? Inguinal canal. Yes. You have to know structure of the inguinal canal. Canalis inguinalis. That's it. So, among all the lateral muscles of the abdomen, external oblique abdominis muscle is the longest. So, it moves downward, and at the level of superior anterior iliac spine, it forms curve backward, and this curve backward is forms inguinal ligament, ligamentum inguinalis. And here inguinal canal is formed. Inguinal canal. Content of inguinal canal in males is spermatic cord, and in females it is round ligament of the uterus. So, no, everything is clear, yes? So, anterior wall of the inguinal canal is formed by external oblique abdominis muscle. Inferior wall is formed by inguinal ligament. Then superior wall is formed by inferior margins of internal oblique abdominis and transverse abdominis muscles, because they are shorter than external oblique abdominis muscle, yes? And posterior wall is formed by transverse fascia. So this is peritoneum, but this is, here we can see transverse fascia. Inguinal canal has an oblique direction, so it goes from lateral to medial side, and it has two rings, superficial and deep inguinal ring. Deep inguinal ring, here we can see it, it is just an opening in the transverse fascia. And superficial inguinal ring is formed by two crus of external oblique abdominis muscle. Medial crus, this one, and lateral crus. Between two crus, laterally there are intercrural fibers, and medially there is ligamentum reflexum. So this is superficial inguinal ring through which spermatic cord leaves inguinal canal. So inguinal canal is also weak place of the abdomen. Inguinal hernia are common. Yes, they are common. They are especially common in males because diameter of spermatic cord is larger than diameter of round ligament of uterus. So it means that inguinal canal in males is wider than in females. So that's why inguinal hernia are more common. Okay, one more thing that you have to know for the next lesson, you also have to study the diaphragm. So diaphragm, here we can see this is diaphragm, yes, it is the main respiratory muscle, and it also serves as a barrier between thoracic cavity and abdominal cavity. Here we can see this is also a diaphragm. So diaphragm, musculus phrenicus in Latin, it is the main, yes, I have already told you. So it is dome-shaped, yes, and this apex of the dome is directed upward towards the thoracic cavity. During inhalation, this dome gets flattened, yes, it gets depressed, and during exhalation, it gets it becomes again convex, yes. So here in the center, we can see central tendon. Yes, central tendon. And also there are several parts, several muscular parts in the diaphragm. Here there is a small part, it is sternal part. Here we can see it, it originates from the sternum. Then there are paired costal parts, which originates from the lower ribs, and lumbar part. So lumbar part starts with two crus, right and left crus. Right crus is better developed than the left one. So right crus originates from anterolateral surfaces of the lumbar vertebrae from the first to the third. From the first to the fourth. Yes, you're welcome to sit down. First to the fourth. And left crus originates from... Алло. Да. Okay. And so left crus originates from anterolateral surfaces of the bodies of lumbar vertebrae from the first to the third. Both of them also originate from medial and lateral arcuate ligaments. You will read about it in the book, yes? And then this right and left crus, they form first decussation, and they form hiatus or opening for the aorta. This is aorta, aortic hiatus. Then again they diverge from each other and then join again. And then that's how they form esophageal hiatus, hiatus for the esophagus. And then all the muscular parts of the diaphragm, they continue to the central tendon. Here in the central tendon there is one more opening, that is opening for inferior vena cava. This is inferior vena cava. So I told you, during contraction, this dome gets flattened and volume of thoracic cavity increases, yes, for additional amount of air. And during relaxation, it again becomes convex and excessive amount of air leaves the lungs, yes, and capacity of lungs decreases. Okay. Diaphragm also has weak places between muscular parts. There are triangular in shape structures, sternocostal triangle and lumbocostal triangle. Here we can see two sternocostal triangles which are located between sternal and costal parts of the diaphragm. So these are places where there are no muscular fibers, just endothoracic fascia adjoins endoabdominal fascia. So this structure is very thin and hernia can also pass through it from abdominal cavity into the thoracic cavity because in the abdominal cavity pressure is higher. And also between lumbar and costal parts, here we can see it, there are lumbocostal triangles, trigonum lumbocostale. That is, yes, it's here. And through it also hernia can,
passes.
yes, pass. That's it. Any questions?
Ma'am, the